Right now, as you watch this, a silent process is happening inside millions of seniors across the country. It doesn't cause dizziness, it doesn't cause chest pain, and it won't make you reach for the phone to call your doctor. Yet, it is quietly sanding down the inside of your arteries, significantly increasing the risk of a stroke or heart attack. The most frustrating part, it's happening to people who are doing everything right. You're exercising, you're eating your greens, and you're taking your supplements every single morning to stay sharp. But if you are over 60 and taking vitamin B12 alongside two of the most common prescriptions in America, that very supplement could be the spark that ignites a cardiovascular crisis. If you take B12 daily, I need you to stop and watch this before your next dose. I'm Dr. Robert Harrison, and today I'm showing you the hidden science that your standard checkup is almost certainly missing. Before we dive into the biology, I want to know who I'm speaking with. Please type your age in the comments right now. This interaction hits differently if you've been on these medications for 5 years versus 15. And I want to tailor my future advice to your needs. We have been conditioned to believe that vitamin B12 is the ultimate safety net for aging. We are told it protects our neurons, keeps our energy high, and prevents the brain fog that many associate with getting older. While B12 is indeed essential, the way it interacts with the modern medical landscape, specifically for those over the age of 60, is far more complex than a simple more is better approach. A major study published in the Journal of the American Medical Association (JAMA) sent shockwaves through the cardiology community when it revealed that in certain high-risk populations, high-dose B vitamin supplementation was actually associated with an increased risk of cardiovascular events and even all-cause mortality. This finding seemed counterintuitive. How could a vitamin meant to support the heart actually harm it? The answer lies in a delicate biochemical dance involving a molecule called homocyan and the way two specific life-saving medications disrupt our internal machinery. The first medication we must discuss is metformin. If you are among the millions of Americans managing type 2 diabetes or insulin resistance, metformin is likely the cornerstone of your treatment. It is a highly effective drug for controlling blood glucose and improving insulin sensitivity. However, metformin has a well-documented but often under-discussed side effect. It significantly impairs the absorption of vitamin B12. It does this by interfering with a calcium-dependent process in the ileum of the small intestine and by disrupting the function of intrinsic factor, a specialized protein secreted by the stomach that acts as a delivery vehicle for B12. When you have been on metformin for several years, your body's ability to transport B12 from your gut into your bloodstream is compromised. This creates a functional deficiency. Your blood tests might show B12 levels that look normal or even high if you are supplementing, but that B12 isn't actually reaching the cells where it is needed to perform its vital functions. When vitamin B12 is trapped in the bloodstream or remains unabsorbed, it fails to fulfill its primary role in the methylation cycle. This cycle is responsible for converting a potentially toxic amino acid called homocyan into a beneficial amino acid called methionine. When this conversion fails, homocyan levels begin to climb. In the world of cardiology, we view elevated homocyan as a silent irritant. It acts like microscopic sandpaper on the delicate inner lining of your arteries known as the endothelium. This constant irritation causes chronic low-grade inflammation. Over time, this inflammation makes the arterial walls lose their elasticity. Instead of being flexible like a rubber hose that expands and contracts with each heartbeat, your arteries become rigid, much like a brittle plastic pipe. This rigidity is a primary driver of high blood pressure and eventually vascular rupture. The second medication is arguably even more ubiquitous: proton pump inhibitors, or PPIs. These include common over-the-counter and prescription drugs like omeprazole, esomeprazole, and pantoprazole used to treat acid reflux, GERD, and stomach ulcers. While these drugs are effective at suppressing stomach acid to prevent heartburn, they create a massive hurdle for nutrient absorption. Vitamin B12 in food is bound to proteins. To release that B12 so it can be absorbed, your stomach must have a highly acidic environment to trigger the enzymes that break those protein bonds. When you take a PPI daily, you essentially turn off the acid furnace in your stomach. Without that acid, the B12 remains locked to the food proteins and passes right through your system. Furthermore, PPIs have been linked in several longitudinal studies to an increased risk of chronic kidney disease. Since the kidneys are responsible for filtering and managing nutrient balance, impaired kidney function further complicates how your body handles high-dose B12 supplements. The combination of low B12 absorption from PPIs and the delivery vehicle disruption from metformin creates a perfect storm for the aging cardiovascular system. When you add a high-dose B12 supplement, often ranging from 1,000 to 5,000 micrograms into this environment, you aren't necessarily solving the deficiency. Instead, you may be flooding the blood with a form of the vitamin that the body cannot properly utilize due to the lack of active transport mechanisms. This excess unutilized B12 can interfere with the very metabolic pathways meant to protect your heart. Research from the Mayo Clinic has suggested that elevated homocysteine fueled by this metabolic dysfunction is present in a disproportionate number of cryptogenic strokes, strokes that occur without a clear or identifiable cause like high cholesterol or a visible blockage. The cause wasn't a mystery, it was a metabolic imbalance that went untested. We also need to look at the type of B12 you are taking. Most standard multivitamins and cheap supplements use a synthetic form called cyanocobalamin. This form contains a cyanide molecule that the body must strip away and detoxify before the vitamin can be used. For a healthy 20-year-old, this is a minor task. But for someone over 60, especially someone taking metformin or a PPI, the metabolic energy required for this conversion is often too high. The body struggles to turn cyanocobalamin into its active forms methylcobalamin or adenosylcobalamin. When the body can't convert the supplement, the homocysteine clearinghouse shuts down. This leads to what we call unstable plaque. In a high homocysteine environment, the plaques that form in your arteries are not hard and stable. They are soft, inflamed, and prone to rupturing. When a soft plaque ruptures, it creates a sudden clot that can travel to the brain or heart in seconds. The goal here is not to stop taking B12. B12 is non-negotiable for preventing nerve damage, anemia, and cognitive decline. The goal is to move from blind supplementation to precision supplementation. If you are on these medications, you need to change your strategy immediately. First, you must move beyond the total B12 blood test. Ask your doctor for an active B12 holotanscobalamin test and a methylmalonic acid MMA test. These are far more accurate markers of whether B12 is actually getting inside your cells. More importantly, you must insist on a homocysteine test. In clinical cardiology, we want to see that number well below 10 to 12 micromoles per liter. If you are sitting at 15 or 20, your healthy B12 supplement is clearly not doing its job and your risk of a stroke is significantly elevated. Second, you must prioritize the form of the vitamin. Switch to methylcobalamin. This is the premethylated or active form of the vitamin. It bypasses several of the conversion steps that are often broken in seniors taking metformin or PPIs. It is essentially ready to work the moment it enters your system. Furthermore, B12 does not work in a vacuum. To lower homocysteine and protect your arteries, B12 requires coactors, specifically vitamin B6 and folate as methylfolate, not synthetic folic acid. Think of these three as a cleanup crew. If one member is missing, the trash homocysteine starts to pile up in your blood vessels. Third, reconsider the dosage and delivery method. Because metformin and PPIs damage the gut's ability to absorb tablets, many seniors benefit from sublingual under-the-tongue B12 or even B12 injections. Sublingual B12 is absorbed directly into the small blood vessels under the tongue, bypassing the stomach acid and intrinsic factor issues entirely. A dose of 500 neo-Cg of sublingual methylcobalamin is often far more effective than a 5,000 Madig pill that your gut simply cannot process. This targeted approach ensures your blood levels remain stable without overwhelming the metabolic pathways that lead to vascular irritation. Finally, I want to emphasize the importance of timing and communication. If you are taking a PPI for acid reflux, do not take your B12 supplement at the same time as your medication. Try to space them by at least 4 to 6 hours to give the vitamin the best possible chance of interacting with whatever natural digestive enzymes are present. Most importantly, bring your supplement bottles to your next appointment. Do not just list them, show them to your doctor. Many healthcare providers focus solely on the primary effects of medications like metformin and may not have the time to investigate the nutrient depletions those medications cause. You have to be your own advocate. The vascular inflammation caused by these interactions is not a life sentence. The beauty of the human body is its ability to heal when the environment changes. Studies have shown that when homocysteine levels are brought back into a healthy range through proper methylation support, the stiffness of the arteries can actually improve. This means you can actively lower your stroke risk in a matter of months simply by changing the way you take your vitamins. You have the power to turn your arteries from rigid pipes back into flexible, healthy vessels. If you found this information helpful, please hit the subscribe button and tap the bell icon. Every week I bring you the clinical insights that usually don't make it into a standard 15-minute office visit. I want you to be informed, not just medicated. If you're going to talk to your doctor about a homocysteine test this week, type protected in the comments. And do me one favor, share this video with one person you care about. Most people have no idea that their healthy routine could be creating a silent risk. I'm Dr. Robert Harrison. Take care of your heart, and I'll see you in the next.